Howdy, I'm Becky McQueen, and I chose to do my evidence-based presentation on IV insertion, more specifically, ways that we can reduce pain and anxiety for our patients around this procedure. IV insertion is required upon hospitalization in at least 90% of patients, and that's just for one site. I know in ICU we require 2 sites, and some surgical procedures require multiple. So IV insertion is required not just in hospitals, ED, OR, ICU, but also in tertiary facilities. So this affects a broad spectrum of patients and nurses alike. And if we can decrease the pain and anxiety around the IV insertion process, we can greatly impact our patients' overall experience when they're with us and of our care. So the 4 studies that I'm offering today, including the meta-analysis, I'm going to start off with a qualitative study that took 10 participants who had had some form of IV insertion, whether it was singular insertion or multiple, and they did a semi-structured interview after. What they found were 3 main themes for the patients. Number 1 was communication. They wanted the nurse to take the time to communicate with them what was involved in the process prior to beginning. Number 2, active listening. They wanted the nurse to find out if the patient had learned any tricks or tips from past experiences of having IVs. Maybe one hand works better than the other, or no matter how good this vein looks, it never works, something along those lines. And third, choices. The patients wanted to be given some semblance of control over their own bodies, whether that was choosing whether or not to have some sort of pain management, or choosing where they would prefer to have their site if possible. And just by offering these 3 simple steps, we can include the patient in this process, incorporate their participation of their care, and increase their overall satisfaction of their care. The next is an exploratory study. Took 30 participants and gave them 3 options regarding pain management: intradermal lidocaine, guided imagery, and none. The participants who chose lidocaine reported the most significant decrease in pain, but all the participants overall appreciated being given the option of the choice, and therefore their satisfaction was increased. Next, I have a study that took 235 patients, applied lidocaine prior to IV insertion, and then surveyed the patients after the insertion, giving them options to rate their pain as none, minimal, or some, and their anxiety as none or reduced. So 186 rated their pain as none, while 75 rated their anxiety as none. 46, their pain was minimal, only 2 had some, and 160 had reduced anxiety around the procedure. Of the 235 participants, 231, however, rated their overall experience as good and the skill of the nurse as, quote, very good. So just by decreasing anxiety and pain, we can increase satisfaction and the perception of our skills. The meta-analysis took 13 randomized controlled trials and analyzed that to determine whether or not lidocaine was most effective in reducing pain. What they found is that lidocaine is the most effective pain management method. However, they couldn't definitively recommend this for practice based on cost effectiveness and drug shortages in most hospitals with regards to lidocaine specifically. So while there are no specific guidelines on pain management and IV insertion, there are precedents that have been set regarding patient care and incorporating the patient's participation regarding their care, using therapeutic communication, active listening, and just overall trying to reduce their anxiety. So in conclusion, nurses, by just including the patients in the process, attempting to decrease their pain, they can decrease their anxiety and increase their overall satisfaction of their care and of their healthcare experience. So thank you. I hope you enjoyed the presentation, and I hope you take this and enhance your patient's experience.